So I think as the new government comes in, it's a really exciting time. There is so much that optometry could deliver, but at the moment we're horribly underutilised. So many of my colleagues are ready, willing, they have the equipment and the skills. We're here to help, we just need the opportunity to do so.
Well, the new government certainly has two things it has to deal with straight away. First of all, it's got a crisis in the NHS with rising waiting lists and GPs under huge pressure. And secondly, it's got very little money to spend. So immediately what we're suggesting is that government can do three things. First of all, taking pressure off secondary care by making much more use of primary care optometry to deal with things that ophthalmologists don't need to deal with. We're talking about minor eye conditions, we're talking about routine glaucoma appointments and so on and so forth. Secondly, take pressure off already overburdened GPs by letting optometrists do more with their prescribing powers. Their prescribing rights haven't been properly revised for a couple of decades.
So the expansion of prescribing powers is one of those sort of non-exciting but really exciting things. It's what I think will turbocharge MEC's and Q's delivery. It will streamline delivery for patients and make it far easier for them to get access to medications, to avoid having to go to their GP, and give a better service at first point of contact, which will hopefully be optometry.
And thirdly, pinning that all together, we need proper and immediate IT connectivity between primary eye care, optometry and GPs and secondary care. It is a nonsense that scans done by high street optometrists using the very latest equipment can't be automatically shared by ophthalmologists in secondary care, and patients have to go to hospital for a second scan for the same information to be recorded.
IT infrastructure is the building block of everything that we need to do. We keep talking about moving care out of hospital into primary care. If we don't have the connectivity to safely exchange images, to safely collaborate with colleagues, then we won't ever deliver that aim. IT infrastructure will allow us to do that. It just needs a bold vision and a little bit of investment to make certain that it happens.
Like all new governments, the new government will be looking to make an impact and do its first 100 days activity to show that it's getting a grip. But with 5 years at least for the new government to plan for, we can expect and want the government to take a more strategic view of the health service. First of all, as the King's Fund has asked for it to do, it needs to rebalance the emphasis in healthcare, in the NHS, away from secondary care into primary care, making much more use structurally of the work of high street optometry. Secondly, and critically, when we look at the sort of difficulties that our primary care colleagues in pharmacy and in dentistry have been undergoing, we need the government urgently to start thinking about the long-term future of contracting with primary care optometry. We all know that the GOS contract is ancient and loses optometrists a lot of money. We need to have a proper economic underpinning for the future of clinical optometry in the high street.
We, as the Association of Optometrists, are keen to work with the newly elected government. Our ask is that we are there as a key stakeholder to help support the NHS. We believe that primary care optical practices are needing investment and are underutilised, and therefore have an ask for commissioning of services that allow us to optimise the care for the patient within primary care, to reduce the need for referrals and to help manage that patient within an appropriate setting.